They say that our uniqueness as Black women makes us stronger. The way we dress, the way we wear our hair, even the way we hit a tennis ball, inspires fresh ideas and monumental movements. But what if our uniqueness starts to cost us opportunities, jobs, our lives? As Black women, we are all too familiar with this duality. Across the globe, we, Black women, are using our voices, artistry, intellect to inspire a more equitable future for everyone. But when it comes to the HIV epidemic, Black women, we remain unprotected, overlooked, forgotten. So how can we make sure that as Black women, this uniqueness that makes us strong stays that way rather than a source of health disparities? There's no clear answer, but I know if we're going to end HIV inequities for Black women, it's a question we have to ask right here and right now. I'm Staci Bush, Senior Director of U.S. Medical Affairs at Gilead Sciences.
And I'm Deborah Wafer. I'm Senior Director of Public Affairs, U.S. Virology, Community Engagement, and Patient Advocacy. Welcome to a special episode of the 0 Hour, because today, sisters are taking it back, all right? We are going to turn it out and turn it up today. This podcast is intended to provide a space for open conversation and about global perspectives on HIV, health, and health equity. Both of our guests today have dedicated their lives to educating young people about HIV. Marlene McNeese is an inspired and dedicated public health advocate for communities most affected by HIV. Marlene has worked for nearly 2 decades at the Houston Health Department and has demonstrated her steadfastness, commitment to HIV prevention that centers the needs of the community. She's currently the chair of the President's Advisory Council on HIV and AIDS. Erica Crittenden has been working in and around HIV treatment and prevention since nearly a decade with the New York City Department of Health and Mental Hygiene and with Pierce County AIDS Foundation in Tacoma, Washington. She is developing collaborative community partnerships to design research that will help address the needs of communities affected by HIV. She's in her 3rd year of medical school at the University of Washington also. So, Marlene, let's begin with you. Welcome. Can you talk to us a little bit about where your passion comes from about HIV prevention?
The year was 1985. I know that it began watching my grandmother, and after her receipt of a blood transfusion, we didn't know anything about what was going on, and watching her wither away. It was when I was 21 and I moved to Houston, Texas, and I got my first job with the Houston Institute for the Protection of Youth. And we were doing HIV awareness and education to other young girls like me. And I learned what HIV was. I took the job because it was a job, but I actually got to learn about what this virus was and what was happening in our communities, in Black communities. And then I recognized all of the time that was wasted, the way my grandmother had to suffer alone with the ignorance surrounding her and in our family, that no one knew what to do or how to respond. I think I made a decision then that this was supposed to be my mission, is to ensure that I'm out and I'm educating and I'm using all the gifts and talents that I have to help my community do better.
So you're also co-chair of the President's Advisory Council on HIV and AIDS, or some people call it PACHA. When you're doing that work, how do you bring the voice of the community to the federal government and tie that into giving advice, I guess, to the president?
It's our rare opportunity to have a seat at the table, to meet with all of the power brokers in this country that wield the resources for HIV prevention, HIV care, they make the decisions. And to do that in a vacuum without community voice is not only dangerous, it's wrong. So one of the missions that I took on, I said, if I assume this role and I sit in this seat, I will unapologetically speak truth to all of that power and ensure that the voices and needs of the community are heard and are heard until these systems get changed. One of the great accomplishments we have is Pacha to the people. We take it outside of Washington, D.C. All of the power brokers may be here in our wonderful capital of the nation, but we take it out to community. And one of the major accomplishments from doing that is having our federal colleagues have to come along with us. And so they get a chance to see, they go see what's happening in these communities. They see what's happening to individuals and to hear the voices of Black women, of brown women say, this is not working for me.
So, Marlene, what is holding us back? What's holding back our efforts in the HIV epidemic for Black women?
It's so multi-layered, and part of the reasons I believe that we're continuing to be held back centers primarily around these systems of healthcare, these systems of public health care, and I work and reside in one, were not originally even built to respond to our needs. They were only built to ensure that there was a way for those who were privileged enough, able enough, articulate enough to get exactly what they need, but that doesn't speak directly to many of the experiences of our people. So if I don't have the confidence to know that I can go into a doctor's office and demand more than 15 minutes of time, if I don't know what their healthcare options are or testing or screening options are, if I don't know, then I'm already disadvantaged. And unfortunately, many of our community health systems are built just that way. So I think that's part of the major reason why for Black women in America in particular are being held back is the lack of information about not only their rights, but their resources. And so here we are today with more than 40 years of responding to HIV for the HIV epidemic in this country, and we still see the lack of awareness and access for Black and brown people, and that's just a crime.
How well do our healthcare systems support access to HIV testing, prevention, and treatment for Black women?
From my perspective, not well enough. I think we need more healthcare providers that look like you, Staci. I know from the moment I step into a health space in that way that I'm safe, that someone has at least one level up of understanding me, of seeing me and responding to me directly. So for me, I think a lot of what needs to change about the healthcare system centers around ensuring that we have more women who look like us, that have our experiences, that are able to talk and treat our community.
Let's bring Erica into the conversation. So, Erica, can you talk to us a little bit about why you care about the work that you do?
This is the first time I've spoken about this publicly, but I was diagnosed with HIV in 2015. At the time, I was pre-med in Teach for America, working in Baltimore, and it felt like my world was shattered, that my dreams weren't going to be possible. Because I hadn't seen a doctor with HIV, and I didn't see that for myself. I ended up leaving teaching and got a job in New York City, working in HIV. And for me, that was a way to cope. But what I didn't realize is that it would just completely change the trajectory of my career and my life. The field of HIV is so beautiful, and it encompasses everything that I was already passionate about. Health, reducing inequities, social justice. And I've been able to not only move through my diagnosis within that space, but to pour myself into my community and into my work. And that's given me a sense of fulfillment that I didn't see when I wanted to be a doctor when I was 8.
So this is a big moment. It's the first time you've said this publicly.
Yeah.
Erica, you are transforming lives right now in this moment all over the world. What is broken, you are about to fix. What is needed in this country is for women to be able to walk into a room with another woman and be vulnerable enough to say, I am afraid, I don't know, I am scared, what does this mean? And for you to be able to say, I was right where you were. And I stepped out. It took a lot of courage for me to do it, but I overcame it, and I sit in this seat so I can help you and anyone else like you. You are transforming lives.
Yeah. Yes. This is a transformative moment. It's a big moment. And I guess I feel a lot of gratitude that you feel okay with sharing that with us. And I agree with Marlene. This is huge. Why did you choose this moment to come out?
I felt like I was ready. It's been 7 years of me holding this. I mean, I work in HIV, and there are individuals in my professional life who are aware, but haven't disclosed publicly within medicine at large, largely because of fear of professional consequences. 'Cause not only as a Black woman do I have to deal with sexism and racism, now I have this other additional layer of stigma that I will now be moving through. But I wanted to speak my truth in an environment that was safe and loving, where I could own my narrative so that nobody else will tell it for me.
You recently presented research on stigma and the impacts of internalized stigma on people living with HIV. What did you find?
This was based in a cohort study in South Africa. And what we ended up finding was that, one, internalized stigma is common and remains common even a year after the time of diagnosis. Mm-hmm. And two, negatively impacts people's engagement in care. So not necessarily groundbreaking, but again, like putting data points behind things that we already knew, that I already knew as somebody living with HIV, but to actually have that evidence to support that. I think as a researcher and future doctor living with HIV, who's also a Black woman, my perspective has sort of shaped the research priorities that I look at. Mm. It's incredibly important to have researchers, healthcare providers that look like us, to be able to define those priorities and have research objectives that really impact our lives, and not what somebody else dictates for us.
You talk about internalized stigma, and there might be somebody in the audience who doesn't know what that is.
So internalized stigma, especially as it pertains to HIV, is taking on negative stereotypes that are seen in society and reflecting that upon oneself. So for me, right, I've been holding on to these fears, and it's the fears that society are placing on me. And I know that, and I've known that. And so this conversation was a part of me breaking through those stereotypes.
Now, when you look at what's going on in this country and you think about women, what do you think is driving the disproportionate impact of HIV with Black women in the U.S.?
I'm not just saying this because I researched stigma, but Stigma. I mean, when I was diagnosed, I had to really advocate for myself to get an HIV test because I was told that I didn't need that. Maybe you can have the chlamydia and the gonorrhea test, but you don't really need an HIV test. Thank goodness I felt empowered enough in that situation to be able to advocate for myself, but it was because of the ideas that we have of who gets HIV that meant that my provider wanted to withhold necessary healthcare from me.
Has anyone ever talked to you about PrEP before?
No, I had no idea what PrEP was. And I've thought a lot about this, about whether or not I would have taken PrEP had I had the opportunity to. And I don't really know that that matters at this point.
Mm-hmm.
What does matter is that I should have been provided that information.
Right.
Somebody withheld that information from me. And when I think about the type of provider I want to be in the future, right, it's guiding someone, right? I'm a medical guide. I'm giving people information to decide what works best for them in their lives. We can have a conversation about it, sure, but myself as a patient, I knew what was best for me. I knew to advocate that I needed an HIV test. And again, I'm so glad I did. It's changed my life in many ways, but I'm very thankful and grateful for myself that I felt empowered enough.
You know, a lot of people don't know what PrEP is, right? What is PrEP?
PrEP, pre-exposure prophylaxis, is a method of taking a medication to prevent acquiring HIV.
Hey, let's bring Marlene back into the conversation. So Marlene, what do you think? Do you think Black women are aware of what PrEP is, or do they understand PrEP and the options around PrEP?
No, and I'm going to claim doctor already for Dr. Crittenton. So Erica Crittenton, MD, is going to be, I think, the game changer in many ways, because it's that sentiment that women are unaware of all of the options for preventing HIV that we have in the toolbox. We are on the precipice and have been for a few number of years now in this country, and being able to use all the tools and have all the tools that we need to end the HIV epidemic. However, we're nowhere close being able to do that for Black women. Just this conference right here at the United States Conference on HIV and AIDS, I heard that Blacks only comprise 9% of individuals who are currently availing themselves to this very effective HIV prevention medication as a tool and as a strategy. And again, I say it's a crime. The idea that many women, many men of African descent are not aware. And that means our public health systems, our healthcare systems are failing in a very critical way by not ensuring that our communities have all of the information about the tools that they need.
So on one side, we have to make access and Black women aware of pre-exposure prophylaxis. But how do we change Black women's perception of HIV prevention?
I have to call up my friend and colleague in Houston, Dr. Mandy Hill, who's done a lot of research around perceptions and attitudes of Black women around PrEP. And one of the things that she's discovered in her research really talks about the cognitive dissonance. There's a real disconnect, I think, for many Black women in terms of how they see themselves in need of a tool like PrEP. So although I know that I may be sexually active, I know that it is possible that I may acquire HIV if I'm sexually active and I'm not protecting myself in any other way. But when offered the idea of, do you believe, PrEP is a tool for you? The answer is, well, no, not for me. And I think some of that is about how we may not have messaged that tool well for Black women. Not being able to see ourselves. And for me, let me speak for Marlene, the idea that I do have an interest on protecting my health. I do have an interest on being healthy and spiritual and sexual. And so I want to have all the tools necessary. And I think that had it become packaged or presented to me in a way that adds value in my world, that really speaks to how this can actually help me achieve the goals that I'm setting out for myself. I just think there's a whole different kind of strategy that we need to bring into play for Black women that really addresses the whole woman and not just what's below my waist. And the idea that the message has to lend itself to, here's a tool, here are ways that you are investing in your health. There has to be ways to make it easy so that I can incorporate it in my very busy life as a mom, as a worker, primary provider, lover.
Erica, what do you think could have been done differently to raise awareness about PrEP in your world?
As a medical student, we're taught to think about people or patients in boxes, right? Risk factors. We literally learn through question banks that define different patients. I wish my provider had seen me as an individual, had listened, provided me just options and education so that I could make that decision for myself.
So what we're messaging to women is not really resonating. And how do you think we fix that?
We sort of not package it in an HIV lens. And I don't know if it looks like a sexual health package, a life health package, but it's got to be sexy to me. It's got to be attractive. Dr. Charlene Flash is another one. Yes, right there with me in Houston, Texas. And a lot of the work that she does when she's working with her own patients is to make sure that they have a plan. But she really listens and works with each patient about, what's your plan? How do you do it? Do you do it in the morning? Do you do it at night? Do you have it with you? Do you take it before you leave the house? I think the strategy has to include practical solutions, easy solutions, and that it is packaged in a way that doesn't center around HIV, because we immediately stigmatize it. We immediately take it to something risky and something bad. There's labels and judgments and all those things. This is not a tool about judgment. This is not a tool about stigma or risk. But in order to make sure people feel that way and see it that way, we've got to present it in a different way.
What's keeping people from, especially Black women, from engaging in care?
I feel like we always just expect people to go into the hospital, to go into the clinic, instead of providers going out into communities and building spaces from there that are safe for people to go to. I often hear, right, people talk about like difficult to reach populations. And sometimes when I'm engaging with, I'll just ask them, when was the last time you went into the community? Have you gone to an event? Have you shown your face so that you're known amongst the people that you, quote unquote, are trying to reach? I think providers or researchers, whoever, need to actually get out into the community if we're going to make any progress towards ending the epidemic.
What about you, Marlene? What do you think we need to be doing more for Black women?
The basics of an operation of hours of access being Monday through Friday, 8 a.m. to 5 p.m. is simply ridiculous. For most Americans, let alone Black women, who I said in many cases are the primary sole breadwinners of the household, who must, by any means necessary, ensure that they take care of their 9 to 5. Those access hours just makes no sense.
That's what I'm saying.
Absolutely.
Like, we expect people to conform to the healthcare system instead of creating systems that work for us.
So what do you think we can do to help bring Black women into fighting this epidemic, or to help end this epidemic in the Black community?
I live in Texas. The idea that a state like Texas that hasn't expanded Medicaid, the idea that you have systems that have said healthcare access is not a right for you. It's problematic to say that we want to help encourage and bring more women and more communities into the fight, into the struggle, when they are still fighting for their lives. Communities in Texas and all over the country continue to be under attack. Our last legislative session ended with the highest number of problematic bills filed in this country, more than 140 bills filed that attacked gender affirming care, reproductive health rights. So when I am told over and over again that I don't deserve access to any of those things, then I find it hard. And we shut down in very subtle ways. I may be disgusted at how I know you see me and how you treat me. And what I do with that might be invisible to you is just simply not show up and simply not engage. We've got to overcome some of these systematic results of trauma and really do what Erica said so eloquently, and that's making sure that we get out to them to create the safe space, to create the safe conversation, to say, I know this system is attacking you. I know what you've been facing. And so now here's an opportunity we have. I'm out here to work with you. I'm out here to bring the service to you. I know that is one of the things that we have a hallmark of in our health department. And unfortunately, we're probably one of the rarest in the country who routinely tries to mobilize services out in community spaces, out in apartment complexes, out in places where it's convenient for them, it's practical for them to be able to see a medical provider, get access to screening services. Those are the kinds of strategies, I think, that we have to mobilize and do before women will begin to trust that there are systems out here that's catching them, that's going to surround them and help them.
I think spaces like this help, right? I felt comfortable enough to be able to share part of my story, and my hope is that that leads on to other folks feeling safe enough to share their story or to feel comfortable with them themselves. Maybe it'll resonate. I'm a big fan of storytelling, and I think that that lends for communication or for connection. I think that having representation within the field of HIV as a Black woman, I'm hoping that that will, I guess, inspire others to share their story.
Can you guys talk about what our allies could do to better support the HIV in the Black community amongst Black women? And what would you call an ally?
I would call an ally anyone who makes way for Black women to have a voice, to have their God-given right, talent, brilliance to be heard. And for me, in this industry, I've been in the industry for more than 30 years. This is the first United States conference on HIV/AIDS, the first national conference I've attended that has centered Black women completely. I think that we are beginning to make an important start in recognizing that we have to have Black women leading the way, because you know the story goes, if you save Black women, you save nations. And to me, that's how we end the HIV epidemic.
What do you think, Erica, when we think about allies, how do you think they can better support us?
Making way, right? Practicing humility, letting go of egos, and empowering future leaders, such as perhaps myself. Empowering communities and individuals to support initiatives that impact them.
What gives you hope?
The sisterhood that I've felt here. I have been isolated for so long. I live in Seattle, and right, we have support groups and things like that, but The majority or all of my friends that are living with HIV are men. And it's just a different experience. The sisterhood that I've felt at this conference today, here in this space, makes me feel that it's possible, not only for myself and, going to medical school and achieving those things, but achieving these loftier goals like ending the HIV epidemic. Because you all are amazing women. Black women are incredible, and I think that's what has really given me hope.
You're not alone.
You're not alone.
Orlean, what gives you hope?
All of the women who have been fighting and loving and giving, that means that where we are today with Black women, where we are today in HIV, is because of the work that you have done. You talk about the sisterhood. There's nothing like it when I get the hug and love of a Black woman who pulls me in close to the chest like my grandmama did and say, we gon' be all right. Then guess what, y'all? I feel all right. It's amazing how that works. That is what gives me hope.
One last question for you both. How does your lived experience shape your understanding of the actual messages we need to send, whether for HIV treatment, HIV prevention?
I think for me, in my experience, it's rare that I have been centered. It is rare opportunity where I get lifted up and celebrated in any way. And so I believe that we've got to ensure that there are spaces where we intentionally say to every Black woman we encounter, what are your individual needs? Because if you ask me that, I'll be able to tell you. And then, though, after I tell you, you've got to respond to that. Our communities are telling us what they need, and we're not doing a good job at listening and responding and creating service systems that honor and match what they're telling us they're looking for.
Same question for you, Erica.
After I was diagnosed, it took quite a bit of time for me to embrace my femininity and my sexuality. Our messages that we put out in HIV prevention and treatment need to embrace and reflect who we are as women and our identities. I take my lived experience and use that to practice empathy. I'm still me. I do feel like a bit of a weight has been lifted.
Mm-hmm.
Freedom. But I'm also excited for the next chapter and what being able to speak openly about my status will mean for my career, for my life personally. Thank you for sharing in this with me, for letting me to speak my truth openly and in a space where I feel very supported.
I think we're all excited to see your next steps. Yeah. And we are here for you.
So thank you, Erica, and thank you, Marlene.
I also want to thank you both.
Mm-hmm.
This has been powerful.
It's been powerful and a long overdue conversation. So HIV, like any virus, does not discriminate. People discriminate, as do the systems that they build. And the longer that discrimination goes unchecked, the clearer it becomes that Black women are being left behind. It's on every one of us to change how we fight against HIV, how we talk about HIV, and how we treat it. Because it's there in our unity, despite our differences, that our strength really lies.
This has been 0 Hour Takeover by Black women. If you liked what you heard today, don't forget to subscribe to 0 Hour wherever you get your podcasts and look for us live on YouTube. For more information, please also visit GileadHIVtogether.com.
This presentation is protected by U.S. and international copyright laws and owned by Gilead Sciences. This podcast should not be copied, reproduced, or distributed in whole or in part without express permission from Gilead Sciences. The views expressed in this podcast are not necessarily those of Gilead Sciences.